Hello my dear students, I'm Dr. Vaishali Bharambe. I've been teaching anatomy for the last 25 years and I love it. What are we going to learn today? Ansa Cervicalis or Ansa Hypoglossal. As usual, what do I tell you? Introduce it to yourself. So first question, what is an Ansa? Ansa means a loop. So whatever we are doing, it's going to be a loop of nerve. Okay? What is Ansa Cervicalis? It's a loop of nerves formed by cervical spinal nerves, hence called Ansa Cervicalis. So branches which are cervical spinal nerves come and form a loop. Why is it taught with infrahyoid muscles? I think by now you know it is taught because it supplies the infrahyoid muscles. Right. So, a very complicated looking image, isn't it? Believe me, at the end of next 10 minutes, you're going to know this in and out. It's not complicated at all. Okay? Look at it now. See that it seems to consist of two parts, a superior root and an inferior root, and this is the loop of Ansa. Okay? Broad outline, you got it? Let's now begin to discuss it in bits. Sometimes that's the better way of learning. Right. So let's talk about fibers coming from C1 spinal nerve. Okay. Ansa cervicalis is essentially a loop formed by fibers coming from C1, C2 and C3. So I'm going to divide it into fibers from C1 and fibers from C2, C3. Okay. So fibers from C1. Fibers from C1 began their journey trying to reach the infrahyoid. But they had a long distance. Infrahyoid muscles are here. The nerves are taking origin from your spinal cord. So, while they were descending, on the way, they found that hypoglossal nerve is going towards the same region. So, what did they do? What is this called as? It's called as asking for a lift, isn't it? It's called as hitchhiking. So, what did they do? They asked the hypoglossal nerve for a lift, isn't it? So, you can see how the C1 fibers now begin to quietly travel with the hypoglossal nerve, not mixing with it, just traveling with it. And as they begin to travel downwards, they give rise to variable branches. Okay? So that's C1 fiber traveling along with the hypoglossal nerve, hitchhiking, dear students. Okay, don't do it, okay? Don't ever hitchhike. But I'm just telling you a concept. What happens is they give rise to branches. The branches they give rise to are one, meningeal branch going to the meninges, a superior root of Ansa cervicalis going to supply superior belly of omohyoid. Out of our four infrahyoid muscles, one has received nerve supply. Leftover nerve travels forward and goes on to supply here the thyrohyoid and then the geniohyoid. So, second muscle of infrahyoid receiving its nerve supply. So we've got superior belly of omohyoid, we've got thyrohyoid supplied both by C1 fibers, out of which only one got supplied by Ansa. Did you note that? Which one was supplied by Ansa? The superior belly of omohyoid. Okay. We'll revise this, don't worry. Let's go to the fibers coming from C2, C3. Before that, the term I want you to remember, yes, hitchhiking. Who is hitchhiking with whom? C1 is hitchhiking with 12th cranial nerve. Right. Let's now go to C2, C3 fibers. As you can see, fibers from C2 and fibers from C3 begin to travel together, forming what is called as the inferior root, also called as descendens cervicalis. This inferior root meets with the superior root to form a loop, which is called as the Ansa cervicalis. Okay. This goes on to supply the inferior belly of omohyoid, sternothyroid and sternohyoid. You saw that all the muscles of infrahyoid muscles are now receiving their nerve supply. Right. So let's quickly revise and then we'll be drawing this, okay? So the revision is C1, C2, C3 fiber nerves are there. Fibers from C1 begin to travel with hypoglossal nerve hitchhike, and then the fibers descend downwards, forming the superior root of Ansa cervicalis. C2, C3 unite to form the inferior root of Ansa Cervicalis. They unite to form a loop which is called as Ansa Cervicalis. They give rise to branches which supply inferior belly of omohyoid, sternothyroid, sternohyoid, superior belly of omohyoid, and leftover fibers of C1 go on to supply the thyrohyoid. This is how cervical branches supply infrahyoid muscles. Also, we are seeing leftover C1 supplying geniohyoid. And just for your information, you can see fibers coming from C4, C5 and C3 uniting to form the phrenic nerve. Okay? Alright, you can remember that information or you may not. We'll now go on to draw the Ansa Cervicalis. You'll be surprised how easily you remember this information. Are you ready, dear students? Come on, get your drawing pencils out and we will start a diagram. Okay? Sure. Okay, students, I hope you're ready. Let's begin by drawing first the loops of C1 and C2, C3. So write down C1, write C2, write C3. Okay? Get the loop from C1 and C2 to move forwards. That from C2, C3 and the C3, C4 loops are posteriorly oriented. Fibers from C1 begin to travel downwards. As they travel downwards, they meet the hypoglossal nerve which was going towards the tongue. The fibers of C1 hitchhike along with the hypoglossal nerve. While traveling downwards, they give rise to their first branch, the meningeal branch. As they descend downwards, they give rise to the superior root of Ansa cervicalis, and then they continue forwards to supply the thyrohyoid and the geniohyoid. The superior root gives rise to branch to the superior belly of omohyoid. Now let's talk about fibers coming from C2 and from C3. These fibers unite to form the inferior root of Ansa. The inferior root meets with the superior root forming a loop which is called as the Ansa cervicalis. From the inferior root, you can see a branch going to the inferior belly of omohyoid, sternothyroid, and the sternohyoid. This very simply is the diagram of Ansa cervicalis. You can now go on labeling it to your heart's content, but this is what it's all about. Okay? Thank you, students. Let's come back to the screen now. Right. Let's now talk about the relations of Ansa cervicalis. The Ansa cervicalis is actually embedded in the anterior wall of carotid sheath. I want all of you to see how this here at the back is your carotid sheath containing internal jugular vein and common carotid and internal carotid artery. In between, you can see the vagus nerve as well. And this here is the loop of Ansa cervicalis, which is embedded in its anterior wall. Let's see if you can solve this MCQ, students. Which muscle is innervated by Ansa cervicalis? We started with this MCQ, remember? Now I'm confident that you know the answer. You know, of course, the answer is sternothyroid. Similarly, Ansa cervicalis supplies all these muscles except omohyoid, stylohyoid, sternohyoid, thyrohyoid, sternothyroid. They all seem the same, isn't it? Yes, but you know, a stylohyoid is not supplied by Ansa. That's the answer. Right. So with this, we come to the applied anatomy for Ansa cervicalis. Ansa is sometimes developing schwannomas. This is a rare thing. Ansa cervicalis is a loop which can be used to re-innervate your laryngeal muscles in case of damage to your recurrent laryngeal nerve, which sometimes happens when we are operating for esophageal cancers. It is also damaged during surgical procedures such as thyroplasty, such as surgeries of the parotid gland, and sometimes surgeries which are done to remove deep cervical lymph nodes. Okay? Finally, the way I see it, if you want the rainbow, you've got to put up with the rain, students. So if you want to be able to solve questions well, perform well in exams, you've got to study hard. You've got to, my advice is, enjoy the process of studying. Alright? Thank you, students. I enjoyed myself as usual. I hope you did too. Please practice your drawings well. It will help you to have a better recall of anatomy. Thank you. I'll see you across the screen in some other video. Bye.